Hello, my name is Marie Beck. I'm the Matron for Haematology and Oncology Trust-wide.
Hi Marie, thank you so much for coming today. Would you be able to talk us through your career pathway development today, please?
So I qualified in 1994 with a diploma in higher education and in nursing, and started my career on a colorectal ward in Bury St Edmunds. Moved to Lincoln in 95 and then started working here. So I've worked on Clayton ward, then became one of the colorectal nurse specialists. I can't remember the year if I'm honest. So started as one of the colorectal nurse specialists and did that for 9 years. And as part of that I did my, my degree in cancer care in Nottingham, and then did my specialist colorectal courses down in London. Then in 2012 I became the Macmillan Head and Neck Nurse Specialist for the county, and did some specialist courses down in London, again to kind of affiliate with the job that I was doing, and then became one of the matrons in 2014, and I've been in that position since. When I started in the matron's post, I had embarked on the first cohort for the Masters in Advanced Clinical Practice, so I completed that with my non-medical prescribers in 2016, and I then now have been successful in being appointed as the new Oncology ACP, which is my next career step, so to speak.
So just a couple of questions for you, if I may. What led you down the leadership and management route in terms of the matron's role?
So it was a 3-month secondment, and I really hadn't factored it into any career progression of mine, which is why I'd started the Masters in Advanced Clinical Practice. It was a 3-month secondment, so I thought it would be interesting to kind of get some perspective of management, because I'd never had been exposed to that. And it has been fantastic for that. The 4 years I've absolutely loved it. I've really enjoyed it, and come away with many skills now I'll carry on into my next role. Came into nursing a number of years ago now, and never really wanted to be a nurse, to be honest. Didn't know what I wanted to do, and my sister was a nurse, so I went to work in the hospital she was a student nurse in for the summer of 89, and absolutely loved it, and never kind of looked back really, and decided then to embark on nursing. I was going into business, and which I cannot see myself being in now, when I look at the career that I've had and what I've done.
So obviously you came to the point where you decided you want to go on to pastures anew in terms of your specialist role. Mm-hmm. What made you decide to stop being a matron and then become sort of more of an advanced practitioner as such?
So as I said, I was Macmillan Head and Neck when I embarked on my Masters in Advanced Clinical Practice, because I wanted to expand on the nursing role, or the advanced clinical practice within head and neck. That was my end goal, was to have fine needle aspiration clinics, look at head and neck lump clinics, do thyroid follow-ups. So I had my career mapped out, if you like, and then sidetracked slightly. So I've always really wanted to go back into a clinical position, but I've absolutely, as I said, I've gained so much out of the matron's role. It really is a fabulous job, and it's a great opportunity now for somebody else to kind of take over from me. So when you do move on, you do leave hopefully a bit of a legacy, but also an opportunity for somebody else to shine.
So in terms of the people that are going to be viewing your story, for those that are just setting out, or for those that are thinking about different career pathways, do you have any advice for them?
Certainly kind of have some career aspirations. I think it's important to know where you want to go, what you want to do. Nursing is really diverse, When you look at, you've got your clinical nurse specialist posts, you've got your clinic posts, you've theatres, you've intensive care, you've the wards, you've clinics. I will forget to mention something, I always do. But it really is so diverse. You've got community, you've got primary care, secondary care, and the world is your oyster really with a nursing registration, I think. And my advice would be to really have a focus. It does shift, as mine has, and some, definitely to the benefit of my career, and for me personally, I think I've gained an awful lot out of everything that I've done in my career. But definitely have a vision, have something to aim for, and if you don't, seek some advice. The Talent Academy are around, you're around to discuss what progressions of organisational development. There's an awful lot there that is appropriate, that is kind of there, lots of things to help you out to decide if you can't decide for yourself.
So finally from me, thank you so much for sharing your story, and on behalf of ULHT we're really pleased to hear the good work that you've been doing. Thank you.
Thank you.